Hi, it's Christy Pasquale. I'm working on getting this workshop up and running. I just have to get my screen right, and then we'll get into the presentation. You're at the arthritis and carpal tunnel, or hand pain and arthritis, and carpal tunnel pain workshop, and we'll get going in just a minute. All right, it looks like there are 4 people on the on our call right now, which is great. We didn't have a chance to really advertise this that much. So if you could just type your name in and what's bothering you, or if you think you have arthritis, if you think you have carpal tunnel, and what seems to irritate it, I can make sure I cover that as part of the presentation. So I just have it's a couple minutes after 6, so we'll get going. I hope to get through the presentation in about 30 to 45 minutes as we go along. If you have any questions, if you could just type them either in the chat box or the Q&A box, and I'll take a look at that as we move along today. And again, try to incorporate the answers to your questions into the presentation. And then at the end, if you have any questions that I find in the chat box, I'll or in the Q&A box, I'll take care of those for you. All right. So before we get started, I just want to give you a little bit of information about us. And it looks like maybe my face is hovering over Katie's face. I'm Christy Pasquale. This is my picture over here. Along with Jim Ferland, we're the 2 owners of Performance Physical Therapy. We have 2 offices, and one office is located in Hebron on Liberty Drive, kind of behind the post office and the medical office complex there. And our other office is located in Colchester on Norwich Avenue, just a little bit up from Town Hall if you're headed towards the high school. We take care of people from both Hebron and Colchester. And I'm fond of telling everybody that in the last 30 years or so, we've been open since about December of 1989. We've treated everybody that lives in Hebron and Colchester at least 10 times, having done 250,000 treatments in that period, and figuring there are 15,000 or so people that live in Colchester and 10,000 or so people that live in Hebron. And if you come into our office, you'll see any one of the 8 physical therapists that we currently employ. So that's the last commercial I'll do. What we're going to do now is follow along on the worksheet. For those of you that registered in advance, you should have received the worksheet. And as we go along, I'm going to try to answer all the questions on the worksheet. If there's something I miss or that you miss, let me know. I'm not going to keep throwing the questions up and filling in the blanks, but I do have a copy of it right here with the answers on it. And as we go along, I'm going to make sure that I answer all the questions. All right, so we're going to start out by, this is a pretty straightforward question. We'll answer these right now. What are the most common causes of hand pain, tingling, and numbness? The workshop is about arthritis, or arthritis in the hand, and it's about carpal tunnel. So those are the answers. So in A, you could put arthritis, and in B, you can put in carpal tunnel, and you'd have 100 so far. All right, I'm just checking out the chat to see what's in there. All right, so it looks like I got some information here from Raman. Okay, so what is arthritis? I don't have a slide for arthritis. This is the slide for carpal tunnel, but we do have the 2 blanks on the worksheet. So arthritis can be broken down into arth and itis, and arth really is short for arthro, and arthro is a Greek or Roman or type of a word for joint. So itis, as you all probably know, is inflammation. So arthritis is simply joint inflammation. And as we go along, we're going to talk about what causes that joint inflammation to occur. And it's really the same things that causes carpal tunnel to occur. And we'll develop that as we move along through the presentation. So now we're going to talk about what is carpal tunnel syndrome, which is question number 3. So carpal tunnel syndrome is, and that's what this slide represents. This is actually the nerve that gets pinched, and we'll define what the rest of these structures are, not in detail, but just to help you understand it a little bit. This slide, though, is just to kind of get us headed in the direction of carpal tunnel a little bit. So the next slide, if I get my computer to advance. All right, so the next slide that I want to talk about is this one. I got my slides out of order. I apologize for that. This is actually the first time we're doing our hand pain and carpal tunnel workshop as a virtual workshop. We normally do them in person. And I use a bulletin board and some other things to demonstrate. So this is a bit new for us. So what is carpal tunnel syndrome? Carpal tunnel syndrome is really caused by a pinching of the nerve. So there's the nerve being pinched. This is on the palm side of your wrist, on this side of your wrist right here. The nerve going right through the middle of your wrist is called the median nerve, and that's actually the nerve that gets pinched in carpal tunnel syndrome. So I'm going to jump ahead 2 slides. If we go back to our worksheet and we start with part A, it's actually pinching of the nerve in your wrist that causes the pain, numbness, and tingling in carpal tunnel syndrome. So we've shown you that. Well, I've gotten myself a little messed up again. I'm sorry. So that goes with that slide. The next slide, the point of this is to show you that the carpal tunnel is actually formed by the bones in your wrist. This is a picture showing the back of your left hand. So it will be like that. And this is actually showing 7 bones, because on this side of your wrist over here, 2 of the bones are stacked up on top of each other. You can see it a little bit, one of the bones on the side there, but there are 8 bones in your wrist that form the carpal tunnel. So for question 3B, the carpal tunnel is formed by the 8 bones in your wrist and the ligament that goes over the top. So on this next slide, this is what it would look like if we slice through your wrist, and then we're looking down into the base of the palm of your hand. Those are 4 of the bones I was talking about in your wrist. And this white piece of tissue going over the top is the ligament across the top. So the bones kind of form a gutter. And you can think of the bones simply as kind of 2 rows of 4 bones that form this U shape with the ligament going across the top. And this yellow thing right here that my pointer is going around, that's the nerve. These white things next to it are the tendons. But the bottom line is, this is what your carpal tunnel is. And when they do surgery, they actually go in and they cut the ligament that goes across the top, theoretically relieving pressure, which gets rid of some of the pain, tingling, and numbness sometimes that can be caused by carpal tunnel. All right. So now that I think I got myself back on track. So what is carpal tunnel syndrome? We're going to go to C, and we're talking about the nerves. So what I want you to realize is that this right here, it's really hard to see, I get it, but there's an M shape right here. This is the nerve that travels all the way down your arm to go through the carpal tunnel. So it being the nerve starts from the nerves in your neck. So all the nerves in your neck kind of come together, and there's a lot of crossing over that happens. They all come together here to form that median nerve. The median nerve then travels all the way down your arm, until it gets to your wrist where the carpal tunnel is. But along the way, the nerves can get pinched in a bunch of different places. So for 3C, and the first blank, it's nerves, and the second blank, it's neck. So 3C1, the nerve, it being the nerve, it gets pinched between the bones and muscles in your neck. So you can get, the nerve comes out in between the vertebra, the individual bones in your neck where it can get pinched. The nerves come out in between these muscles here, which are the scalene muscles. If there's a spasm in the scalene muscles, it can get pinched there. This is actually your rib right here. You can actually get some irritation of the nerves as it crosses the rib, if the rib happens to be elevated. So C, number 1, the answer is the bones and muscles in your neck. C, number 2, the answer is your collarbone and first rib. So if your rib is elevated, you'll get some pinching between the rib that's right here and the collarbone that's right here. If the collarbone is low, you can get some pinching. There's a number of things that can cause pinching to occur between the collarbone right here and your first rib. All right, and then the last place that the nerves up in this area can get pinched, commonly can get pinched, is the muscles in your shoulder. This little piece of bone here is coming off of the front of your shoulder blade. This is your pec minor muscle, and it attaches to your third, fourth, and fifth rib. And you can see the nerves travel right underneath that pec minor muscle. Sometimes this area is called the thoracic outlet syndrome. And in addition to the carpal tunnel nerve or the median nerve, you could have pinching of all the other nerves that go down into your hand, which can cause pain, specific patterns of pain, tingling, or numbness. But what I talk about today for the median nerve would apply for to pinching of those other nerves. All right, so to recap question 3, what is carpal tunnel syndrome? A, it's pinching of the nerve in your wrist that causes pain, numbness, and tingling in carpal tunnel syndrome. B, the carpal tunnel is formed by the 8 bones in your wrist and the ligament over the top. C, it being the median nerve or the carpal tunnel nerve, starts from the nerves in your neck. So nerves in the first blank, neck in the second blank, that travel all the way to your fingertips. It gets pinched between 1, the bones and muscles in your neck, 2, your collarbone and first rib, and 3, your shoulder muscles. All right. So now we're gonna move on to 3D. In addition to pain, tingling, and numbness, your hand can also be weak. Some people talk about their hand feeling tired or getting fatigued, especially when they're doing some sort of a repetitive activity like writing or typing. Typically, it's these 3 fingers for carpal tunnel syndrome. There are other variations where the nerves can cross over. And a lot of times, if you have a problem affecting the nerve to these 3 fingers, you're going to have unusual sensations in your other fingers, and that's not uncommon. All right, so now we're going to move on to question 4. And in question 4, I'd like to give you a little bit more background information, and I've started to give people much more specific information. If you're interested, you can look these papers up. I'm going to talk about them in general terms. First, we're going to do 4A and 4C, and then in the next slide, we'll do 4B. And this information is true for all the other areas of the body that we've come to specialize in treating. And really, we've started to specialize in helping people not take medications, get injections, or have surgery that they may not need. Because for many areas of your body, the neck, the shoulder, carpal tunnel on the hand, the hip, and the knee, the studies are demonstrating that people that get conservative treatment with something like physical therapy, with exercises and hands-on treatment, the right exercises and the right hands-on treatment, do just as well, and in many cases, or in some cases, better than people that have surgery. And that's what the point of this slide is. It's to talk about some specific information for the hand and carpal tunnel, but the same type of information applies to other parts of your body. So 4A, studies show that people do the same with only therapy as they do with surgery and then therapy. And that's what we're going to talk about, or that's what this study was about. It's a 2017 study, and it was a good study, although it wasn't a huge sample size, because they randomly assigned people to be treated with surgery or therapy. And the therapy included treatment of the neck, the shoulder, and the course of the nerve all the way down the arm. And it turns out that people randomly assigned to have treatment for carpal tunnel syndrome with surgery or therapy did the same. They did the same weeks later, months later, and a year later. So to us, that's pretty powerful information. And they've done similar studies for other areas of the body. The one that I like to talk about the most is the shoulder, or they've done the study for the knee as well, where they've actually done sham surgery. They take a large group of people, they divide the group in half. They tell everybody they're in the study, so nobody's getting tricked. Everybody goes to the operating room. They have a scope put in, but in only half of the people, they do the surgery. In the knee, if you have a degenerative meniscus tear or some torn cartilage in your knee, they go in, and half the people, they clean up the cartilage tears. The other half of the people, they just go in and they look around, but they don't do anything. They sew everybody up, they send everybody to therapy. 6 weeks later, there's no difference between groups, and the studies have been done for longer periods of time where it's 6 months, a year, and 2 years later. There's no difference between groups, and that's people that have really had surgery versus people that have had sham surgery where they didn't actually do anything. All right. So we're now going to talk about 4C. So medical tests don't predict who does or doesn't have carpal tunnel syndrome symptoms. And that's what this bottom study is about. And these studies have been done back to the late 80s was I didn't look hard, but it's easy to find lots of these studies. Now, this is a more recent 2018 study in the American Journal of Hand Surgery. I found another study in 1988 that basically said the same thing. And the two medical tests that are used to diagnose carpal tunnel syndrome are electrical testing, where the nerve is either stimulated and recording electrodes on the fingers record the activity, or ultrasounds are used to take an image of the nerve in the wrist to see if it's flattened or swollen. And it turns out that for the electrical testing, 40 to 50% of the people that don't have any symptoms, people that would clinically be considered normal, have electrical tests that indicate that they have carpal tunnel syndrome. And for the ultrasound tests, 20 to 30% of the people that have an ultrasound image of the nerve in their wrist have abnormalities in the nerve, but they have absolutely no symptoms. On clinical scoring systems, they would be a 0, which would suggest to anybody that was evaluating them that they shouldn't have surgery, they shouldn't take medications, and they shouldn't get injections. So the answers to 4A is same. So studies show that people do the same if they have therapy versus have surgery and then therapy. And 4C, medical tests don't predict who does and doesn't have carpal tunnel syndrome symptoms. So if you have carpal tunnel symptoms, and if you go to a physician and they do those tests, we really aren't sure, and we're going to hopefully fill this in as we go along a little more. You really can't be sure if those abnormal findings on that test indicate that you actually really have carpal tunnel, because the nerve can get pinched in your neck between your collarbone and your first rib. The nerves can be getting pinched in the muscles in the front of your shoulder. And there's some other less common areas as the nerve travels down your arm where it can get pinched. So I hope that makes sense. And we're going to talk about that again in a couple minutes. All right, so the other reason that we've come to specialize in all of these areas, you can see on this slide, we have a picture of a hand, shoulder, kind of a low back, hip, knee. Studies aren't really there yet for the ankle, but I suspect that in time they'll be. But the bottom line is we've seen in our office people that have had the surgery for carpal tunnel and they still have the symptoms. Now, certainly it's possible they had severe carpal tunnel and they still have the symptoms because they waited way too long to get any kind of treatment done. But the other reason that people have surgery and still have symptoms is because the symptoms aren't really coming from the wrist where the surgery is done. As we've demonstrated, and I keep talking about, the nerve comes from your neck and it can get pinched between the bones in your neck. It can get pinched between the muscles in your neck, get pinched between your collarbone and first rib, and it can get pinched in the front of your shoulder. And I suspect that that's why the studies demonstrate that conservative care works just as well as surgical care. The other reason is that if you have a little bit of a pinch in a bunch of places, you'll get symptoms. It's like if one person stands on the garden hose, the water still flows. You can think of the nerves as being like a garden hose. And a little bit of pinch in one place isn't going to cause a problem. But if you get 5 or 10 people standing on the garden hose, the water is going to stop flowing. And in the case of the nerve, you're going to get symptoms like carpal tunnel symptoms. And if we can relieve the pinches, if you can relieve pinches in 4 places, the 5th place probably doesn't really make a difference. And the nerve is going to be healthy and you should be fine. I suspect that's what happens in the people that don't get better with carpal tunnel surgery. It's because they have other pinches in other places that we relieve, and the people that get treated without surgery that get better do well because we're relieving all the pinches on the hose in the other places. So having a little compression in the wrist doesn't really make any difference. So I hope that makes sense. So 4B, the answer is it didn't is the answer for the blank. The people didn't get better that had surgery. And when we treated their neck and their shoulder, we worked on their posture and some other things, they got better the rest of the way. All right. Going to check on how we're doing for time. We're 25 minutes in. Now, the same thing applies. It turns out that many people that have carpal tunnel syndrome symptoms also have arthritis. And arthritis is caused by, we're going to talk about more specifically what it's caused by, but it turns out if you have pinched nerves, so the muscles aren't getting supplied, the muscles act like kind of shock absorbers and springs for the joints. So if the pinched nerve is preventing the muscles from working correctly, you get extra force on the joints, and then you end up with arthritis. So really everything I've talked about, I know I'm talking a lot about carpal tunnel, but the same basic causes cause people to have arthritis, as well as compression of the other nerves in the neck that we're not talking about today. All right, so we're going to move on to question 5. With any problem, including hand pain, tingling, or numbness, you can do 3 things. So the first thing you can do is ignore it. It typically sounds like an excuse. I have carpal tunnel because my mom or dad had carpal tunnel. I have carpal tunnel because I pick things up and put them down all day. If you're engaged in repetitive activity, if you're a keyboard all day, things like that are the excuses people tend to use for having carpal tunnel. And it turns out That in fact probably is part of it, but it probably has to do with poor posture, tight muscles, weak muscles, pinched nerves, a variety of things that are pretty reversible, that can actually be taken care of. Your other option, if you have a problem, and in particular, if you have pain, like you have with arthritis of the hand, or if you have carpal tunnel, where you can have pain, tingling, and numbness, as well as the weakness of fatigue, the other thing that you can do is you can alter or mask your problem. Now, that usually looks like medications or injections. And that often will make people feel better. The problem is you don't take care of the underlying problem. If the nerves are being pinched in your neck, if the nerves are being pinched in the muscles in your neck, between the bones in your neck, between your collarbone and your rib, between the muscles in your shoulder, or in your carpal tunnel, that's going to cause inflammation. The inflammation causes pain. What most people will do is take drugs like Advil or Aleve. What the Advil or Aleve does is it blocks the pain, typically by knocking out the inflammation. You do that for 2 or 3 weeks. You feel better. You go back to doing what you were doing, and you didn't really take care of the problem. You just masked the problem. You end up with a re-injury. You end up with more inflammation. You take the medications, and the cycle repeats itself. You're not really taking care of the underlying cause, and taking care of the underlying cause with carpal tunnel is likely not having surgery, because it's likely more than just that one place. And it's likely something that can be taken care of without having surgery, which is a big investment. Although it's relatively routine, it's certainly not without its risks. The other problem with taking those medications is that a significant number of people end up dying from taking these types of medications on a chronic basis. Now, you can go to CVS and buy a 5-gallon bucket of Advil or Aleve or any of those types of drugs, and those types of drugs will, when taken on a chronic basis, and not the way they're labeled. They're certainly labeled not to be taken on a chronic basis, but many people take them on a chronic basis. Those tend to cause bleeding in your stomach, ulcers, perforated ulcers. And I was surprised to find recently, in writing a newsletter we send out to our primary care physicians, that 3 out of every 1,000 people that take those drugs on a regular basis, on a year-round basis, end up dying from taking those drugs. So we think that that's another reason for people not to use medications. And even there are similar medications that are prescription medications that, taken on a chronic basis, lead to bad outcomes, including 3 out of every 1,000 people isn't a lot, but it's still probably 3 too many. The other thing that you can get is an injection, and an injection works the same way. It's usually a cortisone injection. The cortisone stops the inflammation. You feel better. You really don't address the underlying problem. You go back to your normal activities, and you haven't taken care of the underlying problem. The same thing applies to arthritis. I know I'm talking a lot about carpal tunnel, but with arthritis, we can't reverse arthritis with physical therapy, and a surgeon can't reverse arthritis with injections. What we can do, though, if you have an arthritic joint in your wrist or your hand, is if we strengthen the muscles in your wrist and your hand, as well as strengthen the muscles in your elbow and shoulder. We fix the flexibility and the joint mobility in all those areas in your whole arm, including your neck, from your neck down to your hand. We can optimize the rest of the arm, take the extra pressure off the arthritic joint. Many people can go back to their full normal activities without even having to wear a brace or with any other type of support. So if we fix and optimize everything else, then the arthritis pain goes away and you live happily ever after. Just like the medical imaging that we talked about, or the medical test we talked about earlier, the ultrasound to take a look at the nerve in the carpal tunnel, as well as the EMG testing. If you did x-rays of 150-year-olds that didn't have any wrist pain and you didn't suspect arthritis, a significant portion of those people probably have mild to moderate arthritic changes in the joints, those in between those 8 bones in their hand, or in between the bones in their palm, or in their finger joints, yet they'll be fine. So just because you have an x-ray that shows arthritis doesn't mean it's the end of the world. There are things that can be done about it by fixing or optimizing the rest of the extremity. All right. So the last thing that you can do if you have a problem, including hand pain from arthritis or hand pain, tingling, or numbness from carpal tunnel, is to handle it. Now, we've already talked about the traps, and I walk my dog at night on the golf course, so I was inspired to use this slide. You want to avoid the traps. On the golf course, it's the sand traps. In healthcare, there are other traps, and I don't want you to think that we're saying that physicians or surgeons are trying to trap you into having surgery. As a physical therapist, I'm trained to treat people with physical therapy, which doesn't involve surgery, medications, or injections, and we believe it tends to be safer. Surgeons are trained to treat you with surgery as well as with medications and injections. But I don't want you to think that I'm suggesting that they're out there trying to trap you into getting those things. And these days, most surgeons are going to make you go to physical therapy to make sure that physical therapy isn't the answer. But you have to be careful because there are other traps in that. If what you're hearing is, I have to send you to physical therapy before the insurance company is going to pay for these tests, or I have to send you to physical therapy before they're going to allow us to do surgery, or you need to fail physical therapy so I can get the MRI so that I can see what's going on. I want you to know that if you arrive at therapy pre-framed, or if you go to a therapy office that's not motivated to get you better without surgery, you may end up falling into one of the traps. You have information now that that many of you didn't have before. So I hope you find it useful, and it's something that can help you make decisions about your healthcare going forward. All right, I'm just going to see if I can find the chat up here anywhere. And I found it, and there's nothing in it. Okay. All right, and let me see if I can find the questions and answers. And there's nothing in the Q&A box. Good. All right. So for question 5, with any problem, including hand pain, you can A, ignore it, B, alter or mask it, or C, handle it. All right. This is just showing some of the electrical testing that you can have done for carpal tunnel. And I was supposed to talk about the traps there, but this is a new set of slides for me. All right. So the 3 common causes of arthritis and carpal tunnel syndrome are, I think it's pretty evident that this guy has pretty poor posture sitting here. Should be sitting up straight. His head at the middle of his earlobe here should be way back here over his shoulder. His spine in between his shoulder blades should be relatively straight, or actually curved slightly forward like that. And the spine in his low back should be kind of curved backwards like that. So I know that it might be a little bit of a stretch for you to understand, although I've talked about it a lot, but poor posture can also contribute to arthritis. I think you get that it contributes to nerve compression, because sitting with poor posture is going to put pressure on the nerves between the bones in your neck. It's going to stretch the muscles on the side of your neck that the nerves go through, which is going to put pressure on the nerves. It puts your collarbone in a really tight position relative to where your rib is. It's kind of closing your collarbone down on your rib. It lets the front of your shoulder muscles get really tight so that when you do stand up straight, you end up putting pressure on the nerves as they go under that pec minor muscle and the front of your shoulder. So that's the four of the spots that the nerves can get caught in for carpal tunnel. But that's also going to cause stiffness and weakness to develop in the other joints and muscles in your arm, which is going to end up causing you to concentrate force on certain joints, like maybe in the base of your thumb. That may cause you to have arthritis along with the carpal tunnel syndrome in your wrist. So 6A, the answer is poor posture. 6B, it's repetitive activity. I don't have a slide for that. This is the slide for 6C, multiple crush syndrome. So the best thing I could find as a visual is a bunch of crushed soda cans. But multiple crush syndrome is a little pinch in a bunch of places along the nerve. I won't go through them all in detail again, but remember, the nerve can get pinched between the bones in your neck, the muscles in your neck, your collarbone and your first rib, the muscles in the front of your shoulder, as well as in the carpal tunnel. That's the gutter that's formed by the 8 bones in your wrist with the ligament going over the top. That gutter, the ligament transforms the gutter into a tunnel, and it's in there that the nerve can get pinched. All right, so I've been going for about 40 minutes. I'm almost done. I just have one more set of questions to handle here. It's question 7. What does successful treatment of hand pain and carpal tunnel syndrome look like? So, I mean, it's hard to show hands-on care, but what I'm trying to show in this slide is some hands-on treatment. When, for physical therapy to be successful, there are usually 2 things that need to be included. The one thing that's always included, even in what I'll call bad physical therapy, is exercise. You know, we do exercises to strengthen weak muscles. That may help you improve your posture. We do exercises to strengthen tight muscles or tight connective tissue, again, to help you do something like fix your posture. But there are movements that you can't do to yourself through exercise and stretching that need to be restored that can usually only be fixed with hands-on care. So whether that's manipulation of the bones in your neck, manipulation of the muscles in your neck, or manipulation and mobilization of the bones and muscles in your neck, your collarbone and first rib, the muscles in the front of your shoulder. The hands-on care is the other part that's very important to get better with physical therapy. Now, certainly some people will get better with just exercises, and certainly that might work for you. But if you're not getting hands-on care when you're getting therapy, we suggest that you might want to find a better therapy office. The hands-on care is often called manual therapy. So 7A, hands-on PT to correct areas from the neck to the wrist where nerves are getting pinched. That'll also make sure that you have optimal motion in joints away from your wrist or hand that don't have arthritis, so that you can take pressure off of the arthritic joint and probably do normal activities without any limitation. And it's basically the same theory for the strengthening and stretching exercises. And that leads us to 7B, in which the answer to 7B is strengthening exercises for weakness and stretching exercises for stiffness or lack of flexibility. And for carpal tunnel, that'll take pressure off the nerve all the way down the arm from the neck. And for arthritis, we even will strengthen the muscles in your hand. Is emerging evidence that strengthening the hand muscles, just strengthening the hand muscles, can support a joint, an arthritic joint, enough to prevent you from having pain and being able to do your normal activities. Sometimes we use splints. This is a splint I like to use. It's you can get these relatively low profile splints. Unfortunately, I couldn't find a better picture. This splint looks bulkier than it really is. This is called a column splint. A lot of people have arthritis. This is the most common joint for arthritis in the hand, is right at the base of the thumb here. This is basically a soft, supple leather splint, and it's got a little metal stay in the side of it. And that just gives you enough support. It still allows you to move your whole thumb. You can definitely move the tip of your thumb. And for people that are having an arthritic flare-up and are in a lot of pain, if they simply put this brace on, they can function normally until the flare-up goes away. So sometimes we use splints for temporary rest for arthritis. And we also sometimes will use splinting for carpal tunnel, particularly at night, because you move your hands around a lot at night. And if we can put your wrist at least in a nice resting position, you can reduce some of the inflammation in the carpal tunnel, reduce pinching in one of the 5 or 6 common areas, which may get rid of your problem. And then the other thing that we've started to use a lot lately, we've been using a laser. Actually, both offices have lasers now. We use class 4 lasers. The Hebron office has a 40-watt laser. The Colchester office has a 25-watt laser. Lasers have been used in therapy for a long time, but more commonly class 3 lasers. And a class 3 lasers, it would take like 8 hours to get the healing energy in that we can get in 5 minutes with a class 4 laser. Basically, we add healing energy to the system, which can knock out inflammation, and it also temporarily blocks pain signal transmission. You will certainly can get better without a laser. It's the laser just makes it easier and speeds things up, and it's a quick 5-minute treatment. This is an acupuncture type needle, and we use it for trigger point dry needling, which is trigger point dry needling for trigger points or spasms. So we insert the needle into a muscle that has got a trigger point or an area of hypertension, or not like high blood pressure, but it's a little bit of a spasm, or it's got a little extra tone in it. And if we do trigger point dry needling, we can release that trigger point, take the pressure off the nerve, and you can get better a lot quicker. The laser is something that's not common. Class 4 laser is not common in physical therapy. It's something relatively unique to us. I would say at least half of physical therapy offices in Connecticut are probably pretty routinely using dry needling, which is another effective adjunct to getting you better. The important treatments, though, are exercises, including your home exercises, to glide your nerves, to restore the flexibility and strength, as well as hands-on care to get the joints and connective tissue moving that you can't move on your own through active exercises. I'm going to take a quick look at the chat. And I don't see anything in the chat. Get rid of that. Take a quick look in the Q&A. Nothing in the Q&A. All right. All right, so this is my final slide. So these are a discovery visit or free exam. If you go to performanceptworkshops.com, or for registering and signing up for this online workshop, somebody from the office will do a follow-up call with you. But it's helpful if you go to performanceptworkshops.com. You fill out this form for a discovery visit. A discovery visit is really it's a free exam or a free screening visit where we'll take a look at you. We'll let you know what we think your problem or what your problem is or what your problems are. We'll go through what treatment would look like for you. We'll often do a little bit of hands-on care just to kind of as a way to confirm it as part of the screening. We'll often do, for example, a first rib technique to kind of adjust your first rib or the muscles that attach to your first rib, often to demonstrate what impact that'll have on your symptoms. But for registering and coming to the workshop, if you go to performanceptworkshops.com, just type in performanceptworkshops.com into your URL, fill out this form and click register. That'll send an email to the office and somebody will give you a call. Just going to do one more check in the Q&A. I don't see any Q&A, no questions. Another check in the chat. I don't see anything in the chat. So at this point, again, if you go to performanceptworkshops.com, fill in your discovery visit information. We'll set you up for a free exam screening visit. There weren't any questions, but typically when we do an in-person workshop, we stand around and answer people's questions. The question people usually have is about a referral. You don't need a referral. Definitely don't need a referral for a screening visit. If you happen to be somebody that has a type of insurance that requires a referral, we have ways of getting that and working with you and your primary care physician. Although most people in Connecticut can refer themselves to physical therapy, it's been that way for 15 years. Your insurance coverage is the same if you plan to use insurance coverage. We figure out what's wrong with you. We give you the diagnosis. We do the treatment, and we get you taken care of. So nothing's popped in. So I really appreciate you guys registering and coming to the workshop. And I hope we see you in the office and you have a great evening.